Welcome to Bunny Hugs and Mental Health, the podcast that deals with all things mental health. We talk to professionals, survivors, and loved ones about their sometimes informative, sometimes uplifting, and sometimes tragic stories. I'm your host of the show, Todd Rennebaum, advocate, recovering addict, experienced sufferer of depression and anxiety, and author of the children's book, Sometimes Daddy Cries. Hello, I'm Todd Rennebaum, and welcome to another episode of Bunny Hugs and Mental Health. I know this episode I promised you that Tristan DeRocher would be our guest. However, I am waiting till next week to actually release that episode. This week, the provincial budget came out, and so I thought it was kind of took priority. This week, in this episode, I'm speaking to Jason Mecredi. He is the director of Prairie Harm Reduction in Saskatoon. Jason's been waiting to hear about the budget because he is hoping to get some funding for the safe consumption site that Prairie Harm Reduction runs in Saskatoon. It's getting tons of public support from kinsmen. They've donated $40,000. They have small businesses donating all types of money. They have the public donating all types of money. So last year they got no money for the funding for the consumption site, and because of all the public support and all the kind of the hype going on right now about the consumption site in Saskatoon, he was really expecting, actually, not just hoping, but expecting some funding from the provincial government in this year's budget. So he's been waiting, with bated breath for the last year. So the provincial budget came out this year about 2 days ago, April 6th, and unfortunately, once again, $0 is going to the consumption site in Saskatoon. So because of the timing, I thought it was only appropriate that I released this episode this weekend. So I sit down via Zoom and talk to Jason about the budget and about his services and about all the wonderful things that Prairie Harm Reduction offers people, not just in Saskatoon, but in the province. Jason and his team are very hard workers, very passionate people. So because of that, this interview does get very emotional at times. So as a warning, there are some moments where there's adult language. So just a fair warning. One more warning, I guess, about this episode. I've been advocating for almost 5 years for mental health, so I too am passionate, and I can get emotional at times. So, we kind of rant a little bit. But on a personal note, 10 minutes before I was to interview Jason, I got a phone call from my father, who informed me that a cousin of mine took their own life. They were on a waiting list to see a counselor for about 5 or 6 months, and that alone would have got me pretty upset. But the fact that a day before that, the budget came out, and there was a lot of things in the budget I didn't agree with. Let's put it that way when it comes to mental health and addiction. So there's going to be times in this interview where I'm going to seem a little flustered, and so is Jason because of the circumstances and the timing. So anyway, keep that in mind and enjoy the interview. I really enjoyed talking to Jason. He's a great guy. So without further ado, Jason Mecredi. So I'd like to know a little bit about your backstory and how you got into this type of work to start with.
Yeah, so I'm originally from up north. I grew up in La Ronge. I come from a mixed race family. My mom's full Scottish, first gen Canadian, and my dad's Métis and Dene, and grew up mixed race in the north, and late 80s, early 90s and 2000s. I love La Ronge. My family still lives there, but tough town to grow up in for sure. A lot of fights, a lot of drugs, a lot of alcohol.
Mm-hmm.
And I had some pretty serious mental health issues growing up, a lot of anxiety. I have a lot of learning disabilities. I dealt with a lot of racism growing up, and that type of stuff tends to wear on you. And I witnessed my first overdose at, I think I was 14 or 15 at the time. Had a couple friends that were pretty vocal about their suicidal ideation. So you just see kind of like all these issues all the time, and not to mention the racism especially when you come down south. Up north, it was a little easier to ignore, but when I came down south, it was right in your face. And so, I came down here for school in about 2004. Before that, I had moved out on my own at, I think it was 15 or 16. Spent a number of years bouncing around at a couple that basically took me in for about a year and a half. Shane and Debbie Delaney, they basically kept me alive and kept me out of trouble and treated me like their kid, and it was pretty good for me. But then ended up moving down south, and that's when the alcoholism really started to take over. And then because I had a lot of untreated mental health issues and some trauma from growing up, and it took me about 10 years to deal with that. And luckily I've been doing pretty good the last 5-6 years, but you never know when you're gonna have a slip, I guess. But I've been doing not too bad, and I've been working. I worked in mental health for 6 years previous the Prairie Harm Reduction. I ran homes for adults with mental health disabilities and developmental disabilities, and really, really liked working with people like that. And then decided it's time to move on from the agency I was working for, and a job came up at what we were called back then, Saskatoon. We're now Prairie Harm Reduction, but a job came up there, and a friend of mine took me out for a drink and basically said they thought I'd be a good fit, and I've been here ever since. And now we're going on 8.5 years with the agency. I think I'm pretty good at what I do, and started as the support services coordinator, trying to get that department up to a really high level, which I think we achieved. And then eventually I got made associate director, and then got voluntold as executive director. And I've been executive director now for about 4.5 years.
Right on. Can you maybe talk about some of the services that Prairie Harm Reduction has? Because I think a lot of people just understand it as a place where people go and use drugs, and that's it, kind of thing.
Yeah. So we're the only safe consumption site in Canada, which is what everybody knows us for, and that's really like 1/10 of our budget, if that. Really, the big thing that we do is we have a drop-in center that caters to people who use substances. People can come in, they can access public phone, there's a TV there, there's coffee, there's a public washroom. We have safe sex supplies, we have support workers, we have a lot of support workers at our agency. We have 2 departments. One, support services. They run our take home naloxone program, our peer support program, and our systems navigation for people, for income assistance, health. Our advocacy wing, they do a lot of the advocacy work. And then we have on the other side our family support program, and they work with a lot of families in the city that are at risk of having their kids apprehended due to various issues, whether it's substance use, poverty, homelessness, domestic violence, whatever. And this team of majority women go into the hardest hit places in the city and make sure babies and mamas are safe. And if they're not, then we get them to where they need to go. And we have a really good working relationship with the Ministry of Social Services. We're a trusted entity, and we're kind of known for getting stuff done and working with people that nobody can work with. And so those are our 2 main programs. We also do a lot of public education. A couple of highlights from our agency for the past number of years is we did Canada's first Indigenous language condom campaign. We were co-founders of Canada's National HIV Testing Day that we started with the Friendship Center right here in Saskatoon. And then within 3 years, we had a National HIV Testing Day. we've done advocacy with things like we had a youth overdose in Kilburn Hall. They're denied any type of medical interventions. We took it to a coroner's report. Julia, who is our outgoing director of support services, really quarterbacked that one. He did a lot of the heavy lifting, if not all the lifting, but with the lawyer. But we got recommendations in place, and thankfully no youth have overdosed and died in Kilburn Hall since then. We've rewritten policy for the government of Saskatchewan so that people on income assistance can earn more money. We're responsible for most of the expansion and the rapid rollout of the take-home naloxone program in Saskatchewan, and then of course we've done the province's only safe consumption site. So innovation's the name of the game. If you're not first, you're last. We really like to be pushing boundaries in terms of what people think is possible in Saskatchewan. Because all we see here is raw talent, and we see a lot of people that care, and we see a community that does amazing things when they come together. And so that's kind of been our big focus is trying to mobilize the community around this really avoidable situation that we're dealing with, which is record HIV rates and record overdose deaths. And so, it's not an easy hill to climb, but for some fucking reason, it's the hill we chose. And, and I think, we're in it for the long haul.
Yeah. Well, I don't really know you at all, but I'm very proud of all the work you've done and all the work that your staff has done. Did you say you were the only safe consumption site in the country or in the province?
We're the only one for sure in Saskatchewan, and I argue that we're the only one in Canada because we're the only place in Canada that has a legal safer smoking room.
Oh, I see.
It's the mode of ingestion that most people can't offer, and majority of people can't. Any safer smoking facilities that we've seen in other parts of Canada, is basically a tent out back. We based our site off of Lethbridge. They were operational. They were actually the first, but then they got closed down by the Kenny government because the Kenny government's attacking harm reduction left, right, and center out there. And ironically, they closed the day after or the day before we opened. And it's crazy what's happening in Alberta. But I also forgot to mention the reason that drug pipes are available in Saskatchewan. So in any needle exchange in the province, somebody can also get crystal meth safer smoking kit, which is a crystal meth pipe, and or a crack cocaine smoking kit, which is just a crack pipe. And the reason people can get that in the province is because we wrote the policy recommendation and did all the cost analysis. And anybody who's addicted to drugs, nobody knows how to inject the first time. Most people would smoke if it was available, and if you can keep them away from injecting, that means you're not going to be creating a higher chance for HIV transmission. And
right.
So majority of our folks are starting to move to smoking, and even BC right now, they're trying to scramble to get as many smoking sites up and running because they're seeing that majority of people that are dying from overdoses are people that are smoking. And so because they can't come into the safe consumption sites or the safe injection sites or the overdose prevention sites. And so, I think it's something we're really proud of. Definitely we're on the shoulders of giants with Arches and Lethbridge, but right now we're kind of the only ones in the game.
Your hours of our operation, they're only 9 to 5 right now, and you're trying. Sorry?
Yeah, our consumption site operates from 10 till 4.
Oh, okay.
And then our outreach services go till midnight.
And right now, where are you getting most of your funding from to offer all these amazing services?
So all our outreach services are funded by the province for the most part.
Okay.
But our consumption site, 100% is funded by donations and our merchandise. So we have a clothing line, fairly successful clothing line that we've done 2 rounds of. We're about to launch our 3rd on April 22nd. Our first one we sold out in like a month. Our second one we sold out in 6 hours.
Damn.
So I'm like legit hoping our website doesn't crash. But we got an innovation grant through the Canada Community Foundations, Community Foundations of Canada. They gave us an an social innovation grant, and so we're pretty excited because we've been able to expand the clothing line for this launch, and we're pretty hopeful that we're going to be able to make some real money on this.
Yeah. Who does your social media posts? Because I follow you on Facebook, and I mean, some of them are really great and some of them are really funny, and it's just a really good, whoever's doing it's doing a good job.
Thanks, that's me. Yeah, I do our social media.
Is it? Oh, okay.
Yeah, I have a buddy that every once in a while he'll send me a flurry of memes, and I'll use some. He goes a little hard in the paint though, even for me. So, but for the most part, yeah, it's me doing the videos, me doing the memes, me doing the articles. It's a lot of work, but it's a good way to engage the public, especially during COVID.
Yeah.
People can't do much, so a lot of people are on social media. So. We had a media strategy that we ramped into gear when we realized we were going to have to go into fundraising, and I think it's been really successful. Our Instagram followers, I don't know what we're at now, but we started the year just over 1,000. I think we're close to approaching 8 right now. Facebook, we've gained over a couple thousand followers. Twitter was a little slow out of the gate, but since the government cut our funding, we've probably gathered 500 some followers extra. So it's been a good way to engage the public on these files and kind of bring the community together when they see these unjust things happening in Saskatchewan.
Right. And that's Prairie Harm Reduction on Twitter, on Facebook, on Instagram. We're recording this April 7th. It's the day after the provincial budget came out, which was April 6th. And you found out that you are getting $0 again from the province.
Yeah, I got a swift kick to the dick yesterday, that's for sure. Yeah, we found out we were getting nothing, which was shocking, especially because their own internal documents showed that we were going to save them money, we were going to stop people from dying, and we weren't going to increase crime. And so these are Ministry of Health reports. These aren't Prairie Harm Reduction reports. And so, we thought it was a win, especially the fact that we can take a lot of the burden off the emergency room and the ICUs. And I think right now during COVID, people are realizing how much that fucking shit costs.
Yeah.
And we saved the government a ton of money by even operating during the hours that we were. Yesterday during the budget, we were shut down yesterday because we were getting an air conditioning unit installed in our consumption site. Shout out to Boss Plumbing if you, they do us a solid. And, but we were closed just for the day, and we had somebody overdose in the alley, and the fire truck had to come, ambulance had to come, they had to take the person to the hospital, all that shit. And so the costs just are skyrocketing, man. And the government's announced half a year ago, that they were increasing money for the ambulance because the ambulance needed to get more cars on the road to deal with the overdoses. Mm-hmm. So they're funding more ambulances, they're funding more treatment centers, which is great. I think sometimes people get this false perception that harm reductionists hate treatment. I live an abstinence-free lifestyle, but I know that's not for everybody, and not everybody's ready. And this is not the fucking 80s where you can be like, okay, well, eventually they'll come around, they'll hit rock bottom, they're coming around. No, what's going to happen is they're going to fucking die, or they're gonna overdose, and they're going to get a ton of brain damage from lack of oxygen. And then what are we doing with them? And it's just really not okay what's happening across this entire province. And Regina and Saskatoon are definitely taking the major fucking knocks on this, but we're grateful for Niwo Yoten and Regina, and they're going to be stepping up and opening soon. And
yeah,
we got it's clearly in the community hands. We gotta take responsibility for this, because the response from the provincial government is identical to the AIDS crisis in the 1980s and the 1990s, where they just were saying, we don't know what to do, but they knew that back then all they needed to do was get better safe sex education in terms of condom access, and and pushing the treatment, the medication, antiretroviral treatment for people living with HIV, and offering it early, not when they went through the studies. And right now, that's really what we're asking for, is basically the same. The best safe consumption sites are this generation's condom. We need them available widely. because people, just like people are going to have sex, people are going to use drugs. Everybody in this province knows somebody that uses drugs. And if you think you don't, you're just in the dark.
Yeah.
Drug use is so prevalent in Canada. Like, and it's not just, it's not just the alcohol and weed and coffee and tobacco. It's, MDMA, Ritalin, Adderall, cocaine, crack, crystal meth. Like, there's a lot of people that use a lot of substances in this province, and nobody seems to want to talk about that fact. And then, or if they do, like with this government budget that announced that they're $500,000 for an awareness campaign, fuck, give me $5,000. I could give you a way better campaign than you're going to develop for $500,000, and I could run my consumption site.
Yeah.
And so we don't need an awareness. We need the public to be aware of this issue, but like I guarantee most people in Saskatchewan are now aware. And if you ask them why they're aware, it's because of Prairie Harm Reduction.
Yeah.
So it feels like a bit of a missed. It feels like a little bit of a missed opportunity in the budget to send a clear message that they want people to not die, and it seems like they've sent a pretty clear message that they're comfortable with the amount of people that are dying, they keep saying, "Oh, I wish we could do something." Well, you fucking control the purse strings. You could absolutely do something. You're choosing not to do something. So let's be clear on here. You are choosing not to fund the consumption services, and I think that that's going to be a black mark on people's souls. Like when you have the ability to stop people from dying and you don't lift a finger, that's not good, and that's not the way I think Saskatchewan is. Like, I talking to my grandpa who came over in 1906. Like it was everybody helping everybody, and that's such a Saskatchewan way. And then to have a government in power to say there's nothing we can do, or we're not going to help you, is absolute madness. It's just, it goes against our values as a province on every level, that I'm just like, I don't understand it, because I know a lot of the people in government, they're good people. I know a lot of people at the ministry, they're good people. So let's just do the right thing. Like, let's just do the right thing.
How much do you think their decision is based on, what's the word I'm looking for?
Ideology?
Yes, thank you. Political ideology.
It's 100% an ideological decision. When their own documents show that we're saving them money, we're saving them lives, we're not increasing crime rates. Like, what other reasoning is it? You can't tell me it's a financial decision, because, like I said, we're going to save them money.
Yeah. Yeah, it's frustrating.
Yeah, I'd love to hear the reason other than, oh, I wish we could do something. The budget was tight. The budget ain't fucking tight. You're eating up. There's a $2 billion deficit. The budget ain't tight. We're spending. So why aren't we spending to keep people alive?
Well, I didn't write it down here. God damn it. I hate when I come up with good things to say and I don't write it down.
Yeah, no worries, man.
Oh, here it is. So since January 2020, 450 lives have been lost, either confirmed or suspected, due to overdose. But they've only put it, so that's since COVID started, really. And they've only put another $250,000 to address increased need to addiction services as a result of COVID impacts. So they know COVID is impacting overdoses and everything, and they put $250,000. I mean, that is nothing.
Yeah, no, it's a joke. One of the big things they announced was these mobile needle exchange services in Regina, Saskatoon, and Prince Albert. Those services, they already exist. Like these are services that have been in place in some communities, like in Saskatoon, for 20 years. So it's enhanced. There's already a mental health professional. There's already a medical professional. They're already doing needle exchange services. They said, well, we'll probably be doing drug testing. Okay, well, tell anybody that has a drug habit that they have to hold on to their drugs until the van arrives in 6 hours, and it'll be there for 2 hours. You need to hit it in that 2-hour window to get your substance tested. It ain't fucking happening.
Yeah.
So, and it's just weird that was announced, especially like so I don't know about Regina and PA, but in Saskatoon, for instance, where's the highest need for harm reduction services? Pleasant Hill by a fucking mile. So in Pleasant Hill, you have the Tribal Council Needle Exchange, you have ARC Safe Consumption Site, and you have the West Side Clinic, which has by far the biggest methadone patients in the entire province, like the list. They're doctors and nurses and mental health professionals, very well equipped to deal with that. So we don't need harm reduction. We don't need more needle exchanges in Pleasant Hill. We have the Tribal Council right there.
Mm-hmm.
So where are they going to put these? Where are they going to put this van? This new van apparently in Saskatoon. They're going to have to push it into the Riversdale Business Improvement District. Good fucking luck getting that through them. They're going to have to put it in the Downtown Business Improvement District. Good fucking luck getting that through them. The Broadway Business Improvement District. Fucking, I'd like to see some East Side yuppies be okay with the needle exchange parked on Broadway.
Yeah.
And then the 33rd Street Business Improvement District. Like this, like, did they ask any of these business owners or the bids if this was okay? No. Did they ask any of the health officials if this was okay? No. Did they ask any of the CBOs that work on the front line if this was okay? No. So zero consultation went into this. It's going to create a bunch of issues around there because there's no complimentary services. The thing that everybody has been saying is that you need complimentary services around these types of services. We fucking have that at our location. We have that better than most places in the entire country at our location. Not to mention that we come with $1 million in outreach for follow-up immediately after people are done using the consumption services. So, you know, and then on top of that, there's no money to increase needle pickups in these neighborhoods. Our agency's put in over $100K in the last year and a half to pick up needles in the neighborhood. No thanks to the government, who clearly is not interested in doing that. You know, and it just causes more stigma in the community when people see more improperly discarded needles.
Exactly. Well, just by not making this a priority for them, it's, you know, making the stigma still alive and strong.
Yeah.
I work at Pine Launch Treatment Center in Indian Head, and we had a fire around Christmas time. Yeah, we tried to move to a new location. We got basically chased out of there from their town council. They didn't want us in there. And I mean, I'm not on the board and I'm not a manager, but as far as I know, I've heard nothing from any minister or the government or anything trying to help us open again.
Yeah, and so like these new treatment beds they are announcing, basically they're not new. They're like, it's not like we have more treatment beds because of what happened with your guys' facility.
Yeah.
And so, you know, like, yeah, it's this budget was definitely a carbon copy of the previous years, which was really confusing. And I think like we had a lot of hope because they created a whole ministry, mental health and addictions, to deal with this file.
Yeah.
Nothing that we saw in the budget is gonna stop more people from dying. Like we're gonna still see the same rates, or more. Or more. Yeah. And so what measurement, and then some of the language around them was so insulting to people who lost family members, where they said, we feel like our interventions have been successful and our investments have been successful. And it's like, okay, if that's the case, then what measurement are you using? So do you view it as a success that you have a record deaths for overdoses, or a failure?
Yeah,
because
exactly.
That should be a failure. That should not be a mark to say we're doing a good job. You know, it was so shocking. Like I was literally shocked, and it takes a lot. I've been doing this a long time, and we've been told no on budgets before, but this felt like a slap in the face.
So you were surprised?
Oh, very. Yeah, we were very surprised. Especially because we have such good public support. Like businesses support us. You know, at this point we've had close to 3,000 donors.
Yeah.
You know, and like from across Saskatchewan, our clothing line sells out fucking faster than we can deal with it.
Well, how quick did you raise that 80 grand? Like that was, it seemed like 2 weeks you were able to.
Oh yeah, with the Kinsmen. Yeah. So the Kinsmen Club of Saskatoon, you know, they said they were going to give us $40,000 matching. We raised it in 2.5, 3 weeks. Like, this province is like, it's fucking humbling to be from this province, for real. Like people continually step up. We get donations in $3 amounts, $5 amounts, $5,000. Like we get it across the board. And that the Kinsman donation was really pulled together by like mom and pops, $10 here, $20 here. We had a couple of large donations, one from the Better Good and one from realtor John Ashenburner. But like for the most part, there was just these like small little donations, and we were able to pull together, $82,000 in like 2.5 weeks. Like the community cares so fucking much, and it's so shocking to see that our elected officials don't. And so it's just, we're in this weird spot where it's like they're not listening to what's needed. They're not listening to their own data. We the first time when we did the budget ask, we were P's and Q's, minded our own business. Like, yes, please, yes, sir, can we get it? And they told us no. And Minister Ryder, who was the Minister of Health at the time, called us and told us no. And they got us a couple case managers to help us with our caseload. So we said, okay, like at least you're recognizing that this is an issue and that we're valued and we're dealing with this, and we could hire a couple caseworkers to deal with our massive caseloads. Okay, so great. So, and then we're like, we're not gonna come after you. COVID was hit, so we're gonna play ball. We're gonna put all our effort towards, helping on the COVID effort, because we work with the health authority, and like we work with directors, we work with nurses, we work with orderlies. Like we know how fucking hard those people work.
Yeah.
We didn't want to be trying to contribute to their issues or taking away focus, and like it just didn't need to happen. And so we really put it all out effort in trying to help the COVID effort with the vulnerable population. Then we started having people overdose on our back step because we weren't open, and people were overdosing on our back step. And there was one fucking time where I had to give somebody, I think it was 9 shots in naloxone, and I just thought, this is fucking crazy. Like, what are we doing here? We're being polite, and as a result, people are dying, and nobody's showing any interest to do anything different. So that was last July. Our tone changed drastically after that revival, and somebody potentially almost, like, they almost died 50 feet from our door. It makes you question what the fuck you're doing. And so we've shifted our tone. Like, if you follow us on social media, you know that we do not fuck around. Like, we want answers. We demand accountability, and we're not going to do what's popular just because some people in power tell us that we can or can't do certain things. We're gonna do what's right, And at first, I think it definitely cost us some community support, but I think people have seen, Jesus, these guys are fucking working harder than we thought humanly possible. Like our staff boogie, like they work very hard, and and I try to replicate that up into terms of the fundraising and the advocacy and that type of thing. But like we had a client die. We had a client die from an intentional overdose suicide because their needs weren't being met when we tried to send them to all the different systems that we're being told to send them to, and that was a fucking rough day this past January. Like my staff were asking me, openly or through looks or just through the chatter, which was like, what the fuck are you doing to stop this? Like, and I like, this is somebody that when they were in our care in the consumption site, we were able to do multiple successful suicide interventions, but it was when we were closed and when we tried to get them into another facility, and that facility didn't meet their needs, and then they left and killed themselves intentionally. And then, my staff are thinking, we did our fucking job. Yeah. We're not paid at the same rate as the rest of these people. Like if whether it's government or otherwise, like our staff are not paid well, but they fucking come in and do the work with a goddamn smile on their face every fucking day. And they're thinking, why the fuck are we doing this if we can get them covered during the hours we're supposed to have them covered for? We should be open later. We should be open around the clock, but we can't be. And we send them to the people that fucking are, and they can't handle it, and the person dies. Yeah. And so then that comes back on me, and it's like, and it's like, what are we fucking doing? And so it's tough because we're just in this pressure cooker situation that I realize we sound like old man yelling at cloud all the time, but fuck, we got to do something, because when we were nice, we didn't get our way. When we're in their face, we didn't get our way. So fuck, we may as well just do it how we want to do it. And maybe they'll get on board in 10 years when they realize that they could have stopped 1,200 Saskatchewan residents from dying or whatever it's going to be by then. Maybe they won't. I don't fucking know, but we can't wait for government to get on side with these issues, because it's just like this moral missed opportunity where, like, people are dying because you're uncomfortable with the fact that we want to stop them from dying.
That's right. Yeah, it's like I said, the stigma is live and strong, and they're just perpetuating it. I got into addictions, and I'm a boots on the ground working, and that is much more satisfying. Feels like I really am doing more. But we haven't been open since Christmas. We've had, since Christmas, I think we've had 10 or 12 former clients pass away. So and some of them, called Pine Lodge to get back into treatment because they knew they needed the help, and we're still closed. And not because of COVID.
Yeah, that's fucked, man.
So I feel for you, man.
Yeah, I definitely, when we got that, as I called it, the swift kick to the dick yesterday during the budget, I was definitely dejected, discouraged, and then immediately the messages started pouring in, immediately. And the donations started pulling in, and it's kind of crazy that the government's just fine offloading a health service onto small businesses and, and citizens to donate on, but whatever. But it's, the public cares, and they care because this is their family. This is their neighbors. These are people that they grew up with. Ask any kid in high school right now if they know somebody that does drugs, or somebody who's just in the first year or two in university. Ask them if they know somebody who does drugs, and they'll all say yes.
Yeah.
This is not those people anymore. This is us. And so what are we doing about us? And
yeah,
I go and talk to congregations at churches. I talk to community groups, talk to unions. Like people give a fuck, man. Like, people really do care.
That's right.
And I think it's easy to get discouraged when you have, 5-6 people in power who clearly don't. But then when you have thousands of people in the province who really do value people, and I think that, and when you look at, a good example is the Humboldt Broncos bus crash, that everybody was just this is fucking pointless, and everybody donated, everybody came together, and we have record high organ donation rates now in the province because people care. And I think it's the same for the addictions crisis. I think people care. And I think that just like with the AIDS crisis in the 80s and 90s, eventually we're just going to get to this critical saturation point. Sadly, it's going to take time in people's lives, but eventually we're going to get to this critical saturation point where the government's going to have to do best practice. And I'm hoping that they're going to see the light sooner than later. But I'm not waiting for them, and I'm not going to stroke their fucking ego so that they can feel good about making bad decisions on this file. It's not, if we can't speak truth to power, we're fucked as a society, and I think that is the key message that I think we try to drive home is speak truth to power, and speak it clearly, and don't back down just because somebody clutches their pearls or gives you some bullshit, antiquated, made up story about what, when we were first opening the consumption site, we'd often get up these made up stories. People would say, well, what if somebody comes in and they're taking crystal meth and they overdose on crystal meth, and then at the same time you're going to have a fight break out in the drop-in center, and you're going to have somebody overdosing on coke, and I want to know exactly what you're going to do with that. And I was like, well, we got policies to deal with that. We'll triage and do it accordingly. Well, no, I want to approve each policy, and I want to see it. And then I also want to know what you're going to do if you also need to start, somebody comes in and they want naloxone training at the same time. And then, I just said to them, bitch, I don't have to fucking get you on board with our policies. We know what the fuck we're doing. We're the best at what we do. Just let us fucking do what we do. The people think that they can nitpick this shit to death through made up scenarios, but really these are the life or death shit. We're fucking on. We know what we're doing. We have policies to deal with it. It's been fucking approved by Health Canada. we know what we're doing, and like we also work with organizations across the country, but a lot of times, people will try to pick this, but really most people actually do care about what's happening in this province and what's happening to their neighbor. I think sometimes we piss people off with our approach. We often get DM'd and people say, I don't agree with your approach. I agree with what you do. And I say, good, you don't need to agree with our approach, but like we need an in your face approach. Everybody wants us to be MLK,
Yeah.
and take it on the chin. Fuck that. For every MLK, there's a Malcolm X. And we need to have both approaches in this province. And if you think we should advocate differently, you advocate in the way that you want to advocate. Have at it.
That's right.
At the end of the day, it's going to take multiple different strokes for different folks to get different people on board. But I'm not going to pretend like we're not burnt out. I'm not going to pretend like we're not outraged. I'm not going to pretend like bad decisions are being made in Regina, and as a result, we're having 450 people die. Like, I'm not going to pretend like that's the case, because you don't feel comfortable with us swearing. You don't feel comfortable with us pointing out racism. You don't feel comfortable with us, whatever it is. Like, we need to get uncomfortable, because us being comfortable has caused this situation. So we need to get very, very comfortable with being uncomfortable.
Exactly. It's uncomfortable to grow.
Yeah.
You're not growing if you're not uncomfortable.
Yep.
I know what you're talking about, people nitpicking, because when we did try to move Pine Lodge to Fort San, there was a petition going around because everybody was worried that the value of their houses was going to go down. There were going to be piles of needles everywhere. Yet Pine Lodge was in Indian Head for 30 years and not a single syringe has been found.
Yeah,
it's a treatment center.
That goes back to why do you think the province doesn't fund needle pickups?
Yeah.
Like it promotes the stigma.
Yeah. Yeah. Have you ever talked to the new minister, Everett Hindley?
Yeah, we've talked a couple times. Yep, we've met. First meeting was productive. We got our hopes up for sure. Second meeting was a lot more curt. We're hoping that we can work together, but we're not going to pull punches when a decision gets made that's not a great decision. But we've shown that we can work with this provincial government, like between the naloxone expansion, drug pipes, National HIV Testing Day. Like, we can play ball, and we can, like, even the policies for people on income assistance so they could work more hours and get paid better. Like, we can work well and we can play ball, but they have to meet us halfway. And part of it is they have to get comfortable hearing things they don't want to hear, because you can't just hear you're the shit all the time. Like, we're rotten at the core right now on the addictions file. We need to talk about that and talk about the amount of people are dying and be truthful. Is this effective or not? And what we're seeing is that it's not effective, because we have record deaths. And so we need to change our approach. More treatment beds is great. Enhanced naloxone expansion is great, but that's not stopping the people from dying. So we need to try new approaches, and that's where a service like ours comes into play. Like, we're an innovative new approach, and I get that it might be stretching comfortability for them, but fuck, man, like being comfortable has got us into this bad spot that we're in.
Yeah. So the budget last year, or the budget this year for mental health and addictions, it's basically a carbon copy of last year in a lot of ways. But last year there was no minister of mental health and addictions. Mm-hmm. So do you think this is just growing pains for a new ministry, or do you think it's just all for show?
I fucking hope so, man. I hope this is growing pains, and I hope they learned some lessons in the last couple of days. Next year or fucking later, like, there's nothing stopping them from funding us right now. So We'll see if they actually learn their lessons, or are they just going to double down and say that what we're doing is working. And if this is a ministry for show, fuck, man, we're going to have some big problems with each other, because I do not like doublespeak.
Yeah.
Don't tell me it's a tragedy and then you don't do anything about it.
Yeah.
I want actions to match their words. So hopefully this was just a growing pain year, but like, dude, everybody and their fucking dog knows that we should be funded.
Yep. To me, it's like Old Taylor Field. It was crumbling, it was falling apart. They kept putting Band-Aids on it. And that's the mental health addiction system to me. At some point, you just got to tear that bitch down and choose to make this a priority and just start it. Like, don't put 7.5% of the health budget into it. Like, for one time or 2 years, just rebuild this bitch from the ground and, get it going.
We could be the best at addictions. Like, we literally could.
I absolutely agree.
Like, you see, we have some of the best fucking nurses in the country. Like, we have some of the best outreach workers in the country. Like, we could be so fucking good at what we do, but we're being strangleholded on the financing.
Yeah.
And it's just, it's so frustrating, man. It's like I don't know if you ever played any sports growing up, but it's like you have all the talent on the bench, and the coach keeps telling you to dump the puck in, and you're not, you have the talent to be a fucking tic-tac-toe offense, and the coach keeps telling you dump the puck in, and if you don't dump the puck in, you get benched.
Yep.
Let me fucking do a give and go on a one-timer. That's all we fucking want, is a playbook that's going to work and utilize the talents we already have on the bench.
Yeah.
But we're not told that. We're told we're going to dump the puck in and we're going to fucking hold out, and then maybe if we score a goal by luck, it'll be great.
Yeah. And you can't fire a coach.
Well,
not for another 4 years anyway.
Yeah, but it's like, man, it's, yeah, exactly. And it's like, the thing is, like, I've worked with ministers in this government. I've worked with non-ministers in this government, MLAs. There's MLAs and Sask Party MLAs, NDP MLAs, but like there's ministers that give a shit.
Yep.
And when they get the gloves taken off and they can fucking do some damage, it's awesome. Yep. But when we're being hamstrung constantly, and like, I've heard very good things about Minister Hindley. I want to see him.
Yeah, I've heard
like this too. Is a, and like, you can tell the guy's smart as fuck. Like, the guy is smart. So just let him be smart on his file. Give him the money that he needs to fucking implement the things we can do, so we can do the things that we're capable of.
Yeah.
But we're not being given that. And so, it's just like, you want to be on their side, you want to play ball, but if we keep getting these lame duck budgets and we keep getting doublespeak, what are we supposed to do? And I just, you see these nurses that want to make a difference. You see these physicians, these young physicians that want to make a difference. You see these mental health professionals that want to make a difference. These addictions workers, like, you name it. There's all these people that want to make a difference. They want to do these services, but we're continually being told we can't.
Yeah. Yeah. It's frustrating, man. Well, here's a positive. 90%, that's a lot of percent, of people 34 years or younger in Saskatchewan that were polled agreed that these types of sites should be widely available. Is there any satisfaction in knowing that?
Yeah, there's going to be really good satisfaction when we roll these services out across the province in the next couple of years.
Yeah.
Like, and
like 90%.
I think there's a there's a big generational divide, and it's because people are sick of seeing their friends dying.
And I hate to make this kind of stuff political, but I 100% agree with you. I know people in the Sask Party that are, probably just as frustrated as we are. But, what their boss isn't, I don't know. It's just frustrating.
Yeah, but I think, the cause is growing. It's definitely frustrating. I'm the type of guy who likes a fight. I've always liked to fight. And so I'm not afraid to get in a fight. I've been shit kicked before. Like, I can take it, you know? And so I think, I think this province likes people who work hard. I think they like organizations that work hard. And I think they like organizations that stand up for themselves and people that stand up for themselves. And that's exactly what we're doing. We're standing up for ourselves. We're standing up for our clients. We're standing up for our organization. You know, and I think eventually we're going to have enough people that it's going to become undeniable. You know, I think it might take us a while to get there, but you know, I just think you can't have the amount of people dying, and that's 400 individuals that have died. That's 450 families. Those families got kids. Those families got grandkids. Those families got parents. Those families got grandparents.
Yeah.
The numbers are starting to go not in their favor. Like, it's like, okay, this person died, good, or whatever. And then like the detractors favor, where they're like, okay, you know, because we see the social media boards where somebody will, you know, have a burner account and then say, good, these people deserve to die. And they don't realize that, like, it's not just them, it's their family, and it's this wide circle.
Yeah. And
so when you have this many people, I had a friend of mine from high school messaging me today, telling me about another friend of mine who's got bad on an addiction that I didn't even know. And so now we're reaching out, trying to get them supported if we can get a hold of them, you know. But it's like, these are upstanding people in the community. And they're just being taken to task by their addiction, and they shouldn't have to die because they've had a bad couple of years. They, you know, we want to get them back connected with their kids, back connected with their family. It's just like, yeah, man. And these are people you fucking love, you know, you grew up with them.
And they're not all NDP or one party. I know lots of people that vote Sass party that are 100% on board with your consumption site.
Yeah.
So it's like,
yeah, man. And like, tell me one other fucking consumption site in the entire country that had the police backing them.
Yeah.
Like, we work well with Saskatoon Police Service. Like, we talk to them often. Like, they're right from rank and file to leadership.
Yeah. Same in Regina.
Like, and you talk to the fucking cops on the beat, man. They're sick of arresting people because they fucking have a mental health issue.
Yeah.
They want to get these people help. We had an incident in the fucking drop-in center that our staff couldn't handle because it was starting to get so violent. And we called the police in, and you know what that cop did? Did he come and arrest the guy? Did he bash his head in? Did he do what? No, he convinced the individual to seek out mental health support, and then he took him to the mental health support.
Yeah.
Like, the cops are not, they're doing a different approach than they've done forever, you know, and for the longest time. And they want to do things differently. They're sick. The Canadian Association of Chiefs of Police endorsed decriminalization of drugs in Canada.
Yeah, they do. Yeah. Chief Evan Bray is very vocal about that.
Yeah. Like, we have good leadership on the municipal level. Both mayors have endorsed harm reduction. Both chiefs of police have endorsed harm reduction. Our firefighters are some of our biggest backers. You know, we have wide community support on these issues. It's just, we just don't have it right now at the provincial level. And you can't have this saturation of people in the community that see addictions on a personal level. And then, you know, it gets dismissed as a them issue, or, you know, we can only support so many communities. Well, fuck, it's drastically rolling out across the whole province. So you need to figure out a fucking plan, and quick, to deal with this for everybody, because this isn't just a inner city thing. But again, it's hard to argue against the fact that we need a really big investment in Regina and Saskatoon. We make up over 2/3 of the population of the province, and as a result, we make up 2/3 of the addictions crisis.
Yeah. Do you want to? Right now, you got another campaign going, the letter writing campaign. Do you want to kind of explain that a bit?
Yeah, so we have a letter writing campaign on our website, prairiehr.ca. If you go there and click the letter writing tab, it gives you very simple instructions. It takes 2 minutes or less to do. You can just copy and paste the email into your own email address. We give you the links to the email addresses you need to send them to. You just copy and paste those, put them in your email address, and you fire that off. It's going to go to the Premier, the Minister of Finance, the Minister of Health, and the Minister of Mental Health and Addictions, to let them know that not funding the Prairie Harm Reduction is not okay. That they should be doing it, and you don't want to know what they are doing or what they have done in the past, but you want to know what they're doing to stop the overdose deaths from happening here right now. And I think that's a very good question that they need to answer. I don't want to hear that current investment levels are adequate when you have folks dying, and I don't want to hear that it was a tight budget year when they seem to be fine climbing more and more debt. And this is a very small ask to deal with the highest service user demographic in Saskatoon with the most complex needs that nobody else seems to be able to deal with other than us.
Yeah.
And so, and for a 24-hour medical facility, like that is a cheap ask. And we also asked them for multiple price points. I don't know if I talked about that already, but we asked them, for 24/7 at 1.3 million. We asked them for till midnight at 900,000. We asked them for evenings at 600,000, and then for daytime at 400,000. We got denied on all 4 asks.
Well, man, is there anything else I missed?
No, our new clothing line's coming out
April 22nd.
It's gonna be a lot of fun. So if you have the means to buy our merch, check it out.
April 22nd.
But as I said, we sell out really, really fast. So I don't know if this is being released before then or after then. If it's after then, sorry. If it's before then, mark your calendars, because it's going to be going on sale that morning, and we expect it to go pretty quick.
So Jason accidentally said February 22nd, but it's actually April 22nd. The new clothing line comes out, and you can check that out on their website. So yes, April 22nd, Prairie Harm Reduction clothing line. Check it out. Thank you again for taking the time to talk to me, Jason. It was amazing talking to you. I have all the respect for you and your team and all the volunteers and all the people that buy your clothes, donate money, and support you. So keep up the good work. I know you're getting tired and you're getting burnt out, you're getting frustrated, but you're doing a great job. Take a break for a day or two. Okay, next week I promise it's Tristan DeRocher. Now, just to refresh your memory, he's the young Indigenous fellow that walked from Larange all the way down to Regina, set up a teepee on the legislative lawn, set up a photo gallery of people that lost their lives, mostly to suicide, and he spent 44 days fasting. 44 days to represent each MLA that voted down a bill called the Suicide Prevention Bill. He is also a really great guy, and I really appreciate talking to him too, so check that out next week. Thank you for listening, and please subscribe, rate, and review however you are listening to this podcast. It only takes a moment, and it really helps the show out with getting noticed. This episode has been sponsored by Regina Plumbing and Heating. Call 306-585-2000 for all your plumbing, heating, and cooling needs. If you are having a mental health crisis, please call the Canadian crisis number at 1-833-456-4566. In Saskatchewan, the mobile crisis team in Prince Albert is 306-764-1011. In Regina, it's 306-525-5333, and in Saskatoon, it's 306-933-6200. Don't forget to check out my children's book, Sometimes Daddy Cries. Sometimes Daddy Cries is told through the eyes of a boy whose father suffers from depression. He sees his dad get sad, rest, and even go to the hospital, all while comparing his father's depression to a physical ailment. Available on Amazon.ca. I'll see you next time. This is Todd Redebaum saying, make your beds and take your meds. Bye.